Yeah, let's look at this. Just to walk you through this sheet that you have in front of you, this is why I say like this is there's a lot of theory going on here, but actually the more that I've been working with this clinically, in the case of like this woman, for example, who didn't want to live 2 months ago, and now she's like over the moon because she feels great in her body. It just makes me like it makes me very curious about some of these things and how they're interconnected. The form, the function. If somebody has a very Vata Prakriti form, they kind of have Vata functions. They have a very Pitta form, they tend to have Pitta functions. What's that all about? I don't know. But if we then deal with their form to move in a bit of a more ideal way, and when I say ideal, I'm really against this notion of like, you'll see images like this one here on the left, that's like perfect posture or correct posture. I think that's such a terrible terminology for it. I mean, your body's just going to be the best it can be. I mean, like, is it more correct to be like Vata, Pitta, or Kapha? Like, it's not. It's not necessarily more correct to be any of this. But the reality is you have problems when you can't get out of it, when the cycle can't end. Your body tends towards Vata, and then winter comes, and then you're stuck in Vata, and then you never get out of Vata, and then you have your Samprati, right? But when you can go into winter, and then you can move into spring, and then you can move into summer, and you can constantly cycle, then you're healthy. And my ideal with people working at least at the structural level is that we can learn to get out of the patterns where our brain is stuck. Because I truly believe that even when we're dealing with hara, vihara, like these things, we're doing the same thing. Like we as practitioners are helping convince somebody to try something new in their body, experience the results, and then want to keep going. And that's a bit of my goal for this, hopefully. With this first sheet that you have, which it's not going to appear up here, but you can see it in front of you. The top health concerns, I had you all just think about this, and then think about which dosha is involved. Extra points if you get the subdosha, okay? Like thinking about just some of these things. You don't have to have this complete right now, but then also think about what's the value involved. Like what does this have to do with? Is this a circulatory problem? Is this a digestive problem? Is this a more of like an energetic or respiratory problem? Is this an expression problem? Is this a sensory? That would be more udana. Is this more like elimination? Like, how does that actually involve one of the pranas or multiple of the pranas even? Because my theory is that as we explored in this, is then how does that relate to what's physically happening? And if you can change what's physically happening, can you change the function? And if you can change that function, can you then end a cycle and be able to move beyond it? And then as well, just for the thought of it, to get to a bit of the idea of emotional, like which gunas involves? Is sattva, rajas, tamas? Like how is it involved in these things? Because also that's the brain doing its mapping. It's like what activity, what lifestyle is safe. Like most people who are ungrounded aren't ungrounded because they want to be, right? They're ungrounded because something happened or because they were never taught to, like there's so many environmental factors that their brain just learned, oh, it's better to be not in my body. That's just how I'm going to move through life, right? With no,
There's layers of it.
no, no. Does anybody else have a reason why? What's the main culprit for most diseases, anyway? Vata. Yeah. Like when we look at, right, there's like 80 Vata diseases. There's like what, 40 Pitta diseases. There's 20 Kapha diseases. Like if anybody is like has like a whole, and trust me, like I've definitely seen people that walk in with like, these are my meds, and I'm like, immediately that person has a whole lot going on in their nervous system. They're going through it. I don't care if it's their, personally, not that I don't care, I do care deeply, but I'm not going to chalk it up to it's just their liver, it's just that this, it's like, no, Vata is going awry. And if anything, like Abhyanga, Shirodhara, Pichu, like put oil on it, put warm oil on wherever it hurts, get them to slow down and do these exercises you're going to learn, and they will be like, holy crap, you're a magic worker. And all you did was like get them to feel the ground and feel their bodies. And like their prana is now not like dispersing, it's like all of a sudden moving through its own channels again.
Yeah, just I do body work. It's getting.
Yeah. Right. Yes. Yes. Yeah. And also, if you do any of this in the first time, they will be back. They will be back, and you will have plenty of people coming to you and referring you on Facebook and be like, I don't know what just happened, but it was great. Like, I don't know why I'm eating ghee from Costco, but like now I can poop. Like, like it's. Do you, Yes.
Not initially. Say you're not going to work with, so maybe with Marma.
Right. Yes. Precisely. Yes. Yes, yes, yes. Yeah, go ahead.
Just, with oil that they have.
Mhm.
Actually do that initially. Versus
Mhm. Yes. I think it's called murdana. Murdana is like dry massage or like a massage without, it's generally like deeper pressure and it's generally without oil. Um, it's just like a technique within Ayurvedic body work. But this is, thank you for bringing that up as well, actually. It's a wonderful question. Yeah, because that's the thing is like yes, if somebody has Vata and Ama and they have all the things going on, like, yes, you do want to be aware of that. And that's why when you do this sort of stuff first and then their Vata starting to calm down, then it's not just Vata calming down, you're calming the five pranas. You're bringing them more into alignment. And if their five pranas are working, all of a sudden now their apanas working, now they are pooping, and now their samanas working, and now they are digesting, and now they have energy and they can actually make a new habit because they're not just like, oh, I hate life. Like you've given them enough of a sense of change in their body that there's hope. I have this really cute t-shirt that I bought in Jakarta that has this cat that's like laying on the ground like this, and it's super fat. And it just says the words, hope means we can change. And at first I was like, this is ridiculous. I love this. Like when you go to Asia, you can like find all these like it means like maybe nothing in English, or just like something very confusing. But the more I like wear that shirt, I was like, that cat knows everything there is to know. Everything there is to know in these days and ages. And then the next sheet, just to think about what areas are involved with the associated Vayu and symptoms. Are we all familiar with that, or do we need a refresher? You can say yes. Yes.
Yes.
Did somebody say yes? Right. If we're talking about, once again, looking at the functions, if something's happening, basti or waist down, Akva, Shaya, Kati, Sakti, the whole Ashtanga Hridayam, we're looking at Vat being legs, waist, hips, low back, all of that. That's Vat. That's going to be Apana, rather. Then if it's digestive area, core, this is more of an issue. And I even would go far as to theorize that like you could look yes at like the digestive tract, but like even the other internal organs potentially, like those in the internal ring, like if they're not getting massaged, like there's going to be some sort of buildup, like even your kidneys might have some sort of buildup. It's not traditionally thought of as like a samana thing, say, but you just want to like try and parse through like what exactly might it be. And then Dhyana is going to be whole body, but it's also circulatory. Also like thinking about Hridaya, thinking about the chest, but also thinking about, as we'll explore, like shoulders and hip joints, what's going on there. And then Udana is generally considered from diaphragm up, because it's the ability of the diaphragm to go back to ascend and to send energy out, express. We would consider that, I would consider that of like inhalation. If there's not an ability to inhale, and not just inhale, but also expand 360. This would be the case for a lot of people who have issues related to mobility, to joint pain, to pain in general. Like there's an issue with prana. I know. And I know, at least from enough clinical experience, that like if you get them breathing into spaces they didn't breathe, all of a sudden they have more energy. Because their diaphragm is all of a sudden able to pull in more life force. Yeah. Is that clear enough to everybody?
Basically, you're saying that we should be trying, they're not just breathing deeply.
Or they're breathing deeply and it's not 360. They may be breathing very deeply, but then they're walking around like this and their shoulders hurt and they have no idea why. And their low back hurts and they have no idea why, because they do yoga all the time. But they're walking like this. And then they want to like kick their knee up, but their hamstrings are tight. Are the hamstrings tight or is it being pulled up? And then just, this is all theoretical. I'm not going to have you actually like do anything with this now, but hopefully it's just seeds of curiosity. Do you want to move energy up, down, outwards, inwards? This is kind of like gati, like because Vata has its movements. Where do you want it to go? Do you want to feel more grounded? Do you need energy to go into your stomach area? How are you trying to like manipulate energy? Because this Ayurvedis, as we would say in Mexico, we call ourselves Ayurvedis just because it's easier. And you'll meet some of my Ayurvedic colleagues who came with us this year, which is very exciting. We're energy workers. Like we're working with energies. We're working with guna, we're working with fire, we're working with the Panchamahabhuta, like we're energy workers, any way you look at it. And then, do you want to move in a way that's grounding, which I would say is good for when there's maybe like an excess of sattva? Like if you consider that you can have an excess of sattva. You know, people who have like, they're like on their like fourth khichdi cleanse of like the month, and like they don't own anything that's off-white. Like, you know, I don't know, like just like very like a little ungrounded, whatever, maybe too much sattva. Do you need it to be a little more slowing and centering? Like there's a lot of rajas. Like how would you want to practice the asana or even the breathing? Or do you want it to be a little more energizing, uplifting? There's a lot of tamas. Even then you're looking at like the qualities of like going back to that first chart, like what's, you know, at that subtle level, like what's kind of going on in the gunas, and then like how can you, through asana, through how you cue, through how you teach. If somebody's very rajasic, you wouldn't show up and teach like me for the first hour and a half of this presentation. They're going to be overwhelmed. And then the last spot that I made was essentially like yoga asana that could help stimulate these areas. I will leave that up to you, but hopefully it makes sense. Can you kind of get a sense of like what you might be able to do in terms of where you position your body to like bring a little more energy or compression or something into some of these areas? Just a little more life force. And if you need a hint or a clue, part of how I generally, when I sequence, strengthen and then stretch. It's kind of this idea of like counterpose that we have like in yogasana. Generally, if like people are just stretching, most tightness that people experience actually comes from an area where it's stretched. Like if you think of a resistance band, when you pull it, when is it tightest? When you pull it or when you let go? When you pull it. Our muscles kind of do the same thing. This is why, like, for example, if you're a body worker and anybody comes with shoulder issues, just massage them down here and massage their chest and never flip them on the back, and they'll be confused why the shoulders feel amazing. Because they're like, oh my gosh, it always hurts here. And I'm like, I lay down face up, and then I come to the table and they're like this. They're like, did you say face up or face down? And I'm like, I said face up, and that's why there's no headrest. And they're like, oh, and they flip up, and then I don't even flip them over. And I never once touch the area that hurts. We just deal with all the other areas. The support of the shoulder, where gravity normally pulls it down, we clear that area up. And then we go here to the chest. And then we let that feel safe to do this. And then all of a sudden they're like, wow, because I never over massaged and gave them the deep tissue on the area where it's already stretched out. Because they leave that and they're like, oh gosh, I love deep tissue. It feels so good, man. And then they're like, oh, it hurts again. I gotta go back. That's also another way to retain clients. It's a way to not do anything helpful for them. Do what you want with that information. And on the next sheet, okay, actually, let's just look at the last sheet because I don't know how much of this will do. I'd rather just leave you with understanding your lateralization patterns and a few ways to start to work with it, just in terms of time. Because, you know, we're not going to do a whole hour-long yogasana practice. We're not. But in terms of this sequence, on the very last page, what I would recommend, you as your own healer, embodying that energy at some point. Once you've done page 1, page 2, you have some ideas of like, you know, 6 yogasana that might stimulate these areas. That's why there's 6 boxes. And then you understand what your lateralization pattern is. And you start to get a sense of like, you know, hopefully you can just get a sense of like what's going on with your, also walk you through a bit of that, like how can you start to deal with this whole where my basti is in space thing and how that influences the ribs. Starting with Shatkriya, like some sort of cleansing, some sort of just opening up your channels. If we're starting to do pranayam through asana, we want to be able to do like Kapalbhati if you need a little more force. Lovely, helps wake up the diaphragm. Then if you're going to be doing deep, slow, relaxed breathing, also lovely, because you want to strengthen and then stretch. And then you can do something like Nadi Shodhan, just to cleanse out the nadis, which is the meaning of that, Shodhana, cleansing, nadi. We're cleansing out our nadis, mainly like Idan Pingala, but really through all of that. You could do something like joint rotations, Panakriya, and then actually everybody do this, just so you know what I mean. Choose whether we'll just do both. Stretch out your wrists, make circles. And go the opposite direction. All the little snaps and pops are lovely. You want to hear those. If you're working on somebody's like, I don't know, as well, like if you're working on somebody's forearm, go ahead and do this as well. If you're a body worker, this might help you. First, do Indrabasti, Marma, like massage around forearm area. Find where it feels most tight. Does she need help? Somebody help her. Thank you. Massaging into Indrabasti, and then hold Indrabasti and move the wrist around. That is how you get stuff done in body work if you want to. Like when your hands are tired and all you have is your elbow, Like just lean on there and make them do the movement. Because it's about them moving prana anyways. It's not you being the hero of the day. I mean, it doesn't matter. It's about them, their brain being able to be like, wow, I can move my hand around even if there's tension there. And then all of a sudden it's like, oh, I don't need tension there. With that done, close your eyes. You should be able to sense right now Mani Bandha in your wrists. Very alive. And also where that is in relation to the whole rest of your body. And through that, you even become aware of the whole rest of your body. And maybe even your breath. And you should be able to feel Indrabasti on the side you worked on. Hold on. The forearm. That would be an example of like Apana Kriya. I would highly recommend studying with Indu Aurora, a teacher. I'll put her up there in a bit. She taught me a whole lot about pranayama marma in the context of yoga. Like a very rooted way. Like she studied Gurukula since like 16. She has like an immense, like it's like it boggles my mind how much just like being able to practice with her is just it changes your yoga practice and like everything that the way you think about things. I would highly recommend. She calls it Apana Kriya. Essentially, like as well, when there's 5 vayus, I didn't get into this in this, but there's like the 5 pranas and there's also the 5 apanas. So there's the 5 like pranas as we look at, and then each of these actually has a corresponding apana, which would be like the vata blockage of that channel, right? And then through these, you can like start to like as you do that, like all of a sudden you're like, wow, I need to burp. Why? You're somehow actually clearing out samana, right? The corresponding apana of it. Doing joint rotations of all of that and also sensing, which I believe helps kind of your brain and your marma start to map onto each other. Then we'll work on grounding, some stacking exercises. My recommendation that I leave with a lot of people is to do Setu Bandhasan, like bridge pose. I also generally don't recommend it with like trying to get your shoulders just squeezed in as much as possible. Just relax and just lift your hips up. Just activate your legs for most people, especially if somebody's like a chronic pain patient or if they're like a hyper yogi who everything hurts. Like just do less, learn to do less. Just lift your hips up, just get your legs on. And then Ardha Pincha Mayurasana, like dolphin pose. Lovely to get more support through your shoulders, more grounding through your arms. You're grounding through legs, you're grounding through arms. And then you can do some therapeutic Surya Namaskar, which I'll walk you through maybe like 1 or 2 variations of that, just so you can start to be like, huh. And then you could do your yoga asana sequence. You could do any peak pose if that's part of how you like to practice these things. And then you could go back to something that stacks you. Stacks you is essentially, see this person with a very lovely posture on the left, where things are aligned adipati, above hridaya, above nabhi, above pasti, above phala hridaya. When you can get those aligned, stacked one on top of another, magic things can happen. And then grounding again on the side you need to improve. Just you can lock that in. You can have shavasana, and then you can have a meditation. You can work with the 5 pranas. Let's do these tests. You can at least do this, and I'll walk you through very quick. Yeah, some of these like stacking grounding type exercises. Let's actually work in partners for this, because this will also help you work on your eyes. And also sometimes we think we feel something, and it's not what's really going on. As humans, we love to have our little like labyrinths of what we think is true, but truth is sometimes better seen from the outside. Find a partner. I think we have an even number as well. That's magic. Also, there was originally like 3 people going to come to this. Thank you for showing up, everyone. Choose a partner. Choose somewhere around the room. If you have a skirt, I'm sorry, but also you don't need to face the world. You can like face the wall. Find a partner and go find a space. I would say one person lay down. The other of you grab your mat. So we're going to use it. Do you need an extra mat? No, I mean, yeah, one of you is going to watch. You're going to be the assessor. Grab your own mat, because we're going to make a prop out of it. And then what we're going to do, we're going to fold it once, fold it twice, fold it in half. It becomes kind of like a little thicker. And then fold it once more. Now you have this little chunk, a chunk, yeah? And this is good enough. if this were in a different setting, yoga block, Pilates ball, pillow, any and all of those things, something, a thing. Yeah. Let's also have your sheets nearby. If you don't have those, none of this is going to make sense. Also, probably write your name on your sheet, and your partner will be assessing. If you want to, you're going to walk away with your sheets. So make sure you have your information, right? You will be writing on your partner's paper.
You're going.
Yeah. Oh gosh. Is that clear to everybody? Everybody has their partner's paper and their partner has their name on their paper? Still getting it figured out. We're just going to work down the body from shoulders to the pelvis, because what we want to find is which ways things rotate, which will also give us a very good sense, most likely, as to which side this person feels more grounded on, which will give us a sense of where we can improve their grounding and their connection to the ground. And thus, hopefully, in theory, and hopefully as you see in your body, improve systemic mobility. Where are you? I think you take your shoes off if you feel comfortable doing that. For the external rotation test, we want to bring elbows to the sides and palms facing up. Elbows bent 90 degrees. Elbows hugged into ribs. You can look at Helene if you need a reference point. Elbows hugged into sides ribs. Elbows bent 90 degrees. And here, without arching the back, we're going to allow the arms to open to the sides towards the floor. Here we have left. I'm gonna take your information. Why not? Yeah, your right was better than your left. Your left is better than your right. Oh, I don't know. This is external rotation.
That should be the first thing, or the second.
Yes, that should be the first thing. And that has to do with what the correct answer is. First, shoulder internal rotation. Have your person laying on the floor. You'll all get to do this, and I'll walk us through this again. Yes, you're welcome to do that. Then bring your arms out into a T. Palms face up for now. And then from the palms facing up, slightly turn your thumb side of hand is facing up. Like the thumb is pointing up towards the ceiling. Palm facing kind of the same direction your feet would be. Then bend your elbows 90 degrees. So the fingertips are going straight towards the ceiling, arms relaxed on the ground. More like upper arms on the ground? Yes. We want to be in this type position. Yeah. From there, we're just going to help our person make sure that their elbows are 90 degrees. What I mean by that is that like elbows right in line. Yes, as well. Because shoulder internal rotation is the following motion. You can just watch for a second. It's my ability of my shoulders to do this. But in a moment, what we're going to have our people do is lower the wrists forward. But the way to not let them cheat is we cannot do this. Because if I do this, if I open the arms, I can of course touch the ground. But we want to keep our elbows 90 degrees and just lower straight forwards without unbending. For example, for her, you want that elbow to be a little more bent. And then just let your person move the wrist forward without the shoulders coming off the ground. Stop where that starts to feel tight or uncomfortable, or the shoulders want to lift. You can have them go back and forth a few times. Yeah, your wrists move forwards. Yeah? Yes, then we want to see which of those is better. For her, for example, her elbows open quite a bit. We want to prevent that. Keep elbows quite bent, and shoulders not lifting off the ground. Like you want to feel your own shoulders on the back of the ground. And then what I want you to look for is which side comes down lower. Everybody go ahead and lower down one more time and then stop. Which side is able to come down lower? Yes. Please mark that down. Circle the side where it says left lateralization, that column. The left is greater than the right. Or the right lateralization is right is greater than left. Whichever side is greater, circle that side. This side seems to come down a bit more. Okay. Without the shoulder blades lifting. Yeah? Did we all figure that out? On that person's sheet, you will circle which one was better. Was left better than right, or was right better than left? Yeah? Did we figure that one out?
If I'm able to touch all the way, is that normal?
That is normal, and it has to do with your ribs, which is fine. What you can do in that case, you can sit up for a second, and then do it like this. And notice which can come out more there. Questions about this? Got it? Then let's look at shoulder abduction. For this, can you please, Aileen, can you lay on your left side? Everybody go ahead and roll onto left side, and you can use your little prop as a pillow for their lovely, beautiful head. From there, top shoulder, right shoulder goes straight up towards ceiling. Reach this arm straight up. And then we're going to do this without opening the chest and without the arm coming down. If the arm comes down, I can lower it quite a bit. And if the chest twists open, she can continue to lower it quite a bit. We want to keep the chest moving straight forwards. And without that moving back, or without that twisting open, right, she'll start to move this arm back. Stop, Aileen, when you start to feel your chest wanting to twist open. Without the hand going down, hand going straight back. It's like we're doing this. Yeah. Without the arm going up or down, just going straight back. Yeah. And then you want to see the angle of it. Once you get a good idea of the angle of it, have them roll to the other side, to the other side. I'm imagining this is going to be more. We'll see. And then have them do it on the other side. Yep, yep, arm straight up, and then reach the arm back. Palm is open. Yep, palm towards ceiling. Yep, this side. Does this side feel more free? Yeah. You stop when it feels tight or when the shoulders start or when the chest starts to twist open. Yeah, note that down. Are we noticing how all of a sudden we thought we were normal yogis and we thought we were just going to do our Surya Namaskara on the left and the right and everything's going to be fine, but we have all these imbalances. What's that all about? I thought you've been stretching the whole time. It's not the muscles, it's where the joints are positioned.
Yep.
Have we all done this for these three? What is the average? There's 3 tests you just did. Which column are they in? Is there at least a pattern of 2 out of 3 being on one side? That's good information. What does that mean? That tells us that their chest, for example, if I can adduct my shoulder more, if I can do this more on this side, that means my chest is twisted to that side. Yeah? All of your tests line up, which you twisted. Let's figure out the hips. Is that interesting enough? Do you want to do hips or do you want to switch? Let's switch first. You want to do the whole thing? Let's do the whole thing. Pelvic rotation. Can you have your arms out in a T, Haley? Arms out in a T. Palms, I like to just have them facing up. Knees bent, feet on the floor. From here, keep your knees together. And if that's difficult to do, you can always put a prop. It's just for the sake of it. You squeeze that. Then keep ankles together. Squeeze ankles together. Lovely. From there, without a shoulder coming off the ground and without knees separating, which is why the prop is helpful, and without ankles separating, lower your knees over to the right. Stop before the shoulder comes off the ground or before things separate. And then go the other way. This side's doing more. Can you feel that? Yep. Mark down which side. You can also ask your client or your person which side feels better. Feeling doesn't always give the best picture. Sorry? This is the pelvic rotation. Right here, we're literally just rotating pelvis left and right. Which side is easier?
You felt time to
I would say go more based on your observation than what they feel. And it's not to be a jerk, but it's sometimes when you're working with a client, when you can give them something objective, it's very good for type A personality, what I said.
how
Uh-huh.
and more rotations.
Right. Yes. That's lovely. Hip abduction. Can you now place the prop underneath the head and roll onto one side?
This was the
Either side.
rotation.
Either side. That was pelvic rotation. From here, they lay on their side totally straight. What we want to do for hip abduction is the following. If you remember earlier, I had you like twist onto one side and then do that. One thing, I'm also trying to give you the how to not cheat method, how to make sure your person, because our body's used to cheating. Our body's used to being able to do this, right? But how do I do this? Is I externally rotate. If I internally rotate my foot, basically I'm kind of like pigeon-toed, and then I try and lift, how far can it go? Right. But we want to see that we stop the test basically where it starts to feel like, that's it. That's all I want to do. or before it starts to want to externally rotate. Do that on both sides. Okay, see which side comes up. Also, tuck your, come back down for a second. Like, kind of tuck your forward a bit. And then try and feel that both sides. And then do the other side. Yeah. Sorry? Yeah. Let's see the other side. Have them do the other side and notice which side can come up more. Okay, here you kind of wanted to twist, I think. Aha, like there, it starts to want to twist. And it feels tighter. Your right is better than left. Aha. Interesting, huh? Let's do our. Does everybody have that? Yeah. Everybody has that?
Yeah.
Questions about that? Straight leg raise. Can you lay on your back, Haley? Legs straight. And for this, I'm in between right now whether I'd like people to do this with their ankles relaxed or feet flexed. But essentially what we really want, like that doesn't particularly matter. What we really want is that their knees don't bend. So Haleen could, just as an example, Haleen, can you lift this leg up and then start to bend the knee and keep the knee moving towards chest? Yes. Oh, that's easy. Now, lift this leg up, and at some point when it wants to stop, bend this knee. Now bend the bottom knee. Oh, she can keep going. Not the point. Want to know which leg can do that without the legs bending? Which side comes up higher? Straighten one leg, lift it up, stop before things start to bend. Now let's do the other side.
This one got to stretch out already.
But better on the right, it seems, for this one. Interesting. Because there, I don't know, let's see the other one again. Interesting. Seems more on the right. Because there things start to bend. Yeah. Also, some people have trained some, especially if you're like a yogi or like if you've trained your hamstrings much, they'll be able to do this anyways, which is why there's multiple tests. Yeah. Next one. Yeah, we have enough tests to figure things out. Now grab onto your pillow, place it in between the thighs, feet down for a second, just so I can explain this. We all know that when we externally rotate our hip, we're doing this, like Baddha Konasana, right? We're gonna have feet together, we're doing this, externally rotation. Internal rotation is this, would be the opposite. With that said, for this test, you may just want to watch me for a second. For this test, once you're up, you want to have the prop in between the thighs and you don't let the prop go and you move the ankles away from one another. Can everyone see this side is a bit more? You want to see that for your person. You can have them do it like a few times, okay, maybe 2 or 3 times, and then hold it. Just enough to see where is more.
My ankles want to like exaggerated.
Right. Okay.
Go further.
Yeah. How does it feel?
Weird.
Feels weird. Yeah. Tell me when we have that figured out.
Yes.
Yeah. Was it clear for her? This one? Good. Next. Did you all figure it out?
Yes.
Yeah. For external rotation, she's figuring it out. There's 2 ways to do this because sometimes this is whatever. There's ways that I've noticed we can do this. One is to have your feet together, basically come in Baddha Konasana, but on your back, knees apart, feet together. And then you would want to get at an angle where you can see, which side seems to open up more. Here, like which side is lower to the ground. That's one way. If that's not clear, I would also like you to do the following.
Equal.
If they seem very equal, then do the following. Straighten legs out again. Aiming to bend this knee, have it above the hip. And foot up. Yes. Then cross your other, basically here we want to do this. Cross your left arm to the outer edge of the right knee. And we still want to have that positioned enough. Just let me glide your knee there. And then from there, remember, external rotation is this. This is just to keep the knee above the hip and then have them move their ankle inwards. And we want to stop before things start to like move all around. Good. Let's see the next side. Straighten this leg out.
Yeah.
This side, yeah. This side seems to be more both of chest. The better left. Ooh, Haleen, I'm seeing a pattern. Did we figure these things out? Yeah. Do we still want to stick with the same person before moving on? Yeah, we will do each other. You need to see.
Yeah.
Better like this. Yeah.
Right.
Yeah.
Yeah.
This is extra. Just remember, it's doing external. Add more, yeah. Definitely. I think let's do the following just because we now have a lot of information about this person. Does anybody notice a pattern?
Yeah.
Is there like a lot more on one side of the column? I'd like you to add up how many they have on one side versus the other. Helene, we'll get there. That's where we're going right after this.
Yep.
For your upper body, we had all of these point to left. Your chest twisting to the left. But then your lower body, there seems to be more. At least 3 out of 4 more to the right. Huh. So your body's, yeah, your body feels like it's doing this and also like this. It's very normal. Well, because remember, we're doing this. Sometimes our body just got kind of froze somewhere where it's, you know, midway in that pattern. Questions about this before we do the grounding performance? Does everyone have like one side that has majority? And you may also have one thing going on with the upper body and one thing going on with the lower body. Yeah? What we want to do for the grounding performance, can I use Hugo for a second? Okay, just add a wall. What's your name again? Britt. Britt, can you bring your head away from the wall? Okay, feet towards the wall. Yes, yes. If my body is more right lateralized, we're going to assume that the grounding performance is better on the right. Assume. Not always safe to assume. We're going to figure out, right? But, well, if the performance is going, if my body is right lateralized, there's more on the right column, then I'm assuming that the body's weight feels safer over to the right, which means if I do my left and things improve, I now know which side I need to practice on. Let's just assume, because I have seen this not be the case, but that's also a thing. If you think about somebody who their center of gravity is to the right and they don't feel safe putting weight on the right foot, how the heck do they move through life? Of course things hurt, because their body's having to figure out some other way to do things, right? For this, side lying grounding, can you lay on your side? And we basically want to imagine we're laying in a chair, but with our feet on the wall. We need to get close enough to the wall. And then you can have the mat under the head. Mat under people's head, and then feet on the wall. And we basically just want to be able to feel the feet on the wall. We don't need a lot of force. Yeah. And which side are you laying on? Which side is she lateralized? Yeah. Lay on your left, please. Because in theory, if we were to reinforce the pattern, like we're reinforcing a dosha, it's not what we want. We want to create balance. In this position, try and practice getting them stacked. Then you want to see like the central marma. Okay, here, yes. Yeah, you basically self-adjusted. Feet are on the wall, head is supported, and they're laying on the side they need to practice. Does that make sense, everyone? But not the side they're lateralized, on the other side. Yeah, then let's practice inhaling through nose, exhaling through mouth, and letting weight fall.
Yeah, we actually had a family here. We went up to Portland to visit friends and just drove down the coast.
You guys have questions?
It's been an adventure. It was awesome. I had to take one-on-one the whole
And
way.
let's just figure this
Yeah.
out. Okay, parts. Let's do this. Coach your person. Drop some rounds of breath. Second, through the femoral internal rotation. This one. The shoulder internal rotation. Yeah. Coach them through 10 breaths. Inhale through nose, exhale through mouth. Trying to be very calming and topic, you know. And then test those two things. Yeah. Let's just see how you really works. Okay. Let's see the rotation. Yeah. Okay.
now, just like breathing.
Shoulder.
Okay, so let's take 10 deep breaths.
Let's do it when you're done. So feet on the wall.
Andrew? We're just doing the 10 deep breaths and then retesting?
Yes, all we're doing.
And retesting everything you said?
Just the internal rotation of hips and shoulders.
Thank you.
So feet flat on the wall. Pushing through.
Right. Breathing.
Yes. Let's let me have people finish their breathing. And then just test.
Which one's internal?
I remember the one, it's the one where you did the back wheel stuff. There's the leg. Yeah. One at a time.
It's been about 10 breaths.
Yep.
So that's the external rotation. The internal rotation would be the
This
thing
is internal?
that's external. The internal is with the thing in between
Yes.
the thighs.
Which one is the arm? Which is
This is the arm.
Okay.
Yes. Then we want to see, did something change? Like, did something improve? Wow. Yeah, do the arms and do the hips. Yeah.
It's a great workout.
There's a change. Did it get better? Did it get better on the side with worse?
Yes.
Oh, you did the same on the side. What?
Yeah. It's about the same actually. Which?
Internal rotation is this one. That's, we just want that and the hip internal rotation. Just those two things.
Yeah. It's about the same, which might mean that you're settling. No, I was.
So. Yeah, this side.
Oh, yeah, then you're moving your legs. So
Yeah.
like, yep, and then somewhere else.
Okay, let's do shoulders.
This, I'm.
Shoulder.
I saw it. Which.
Which loves the original.
Yeah, before was your right. Now it's your left.
You saw it in different things, right? Let's just let that be.
Wait,
Okay, so pretty.
no, it was your right. That was the internal before was also left. We didn't have a lot of change. Her internal and her left was still had a greater range of motion. than the internal. It was pretty, and then her internal shoulder was pretty much exactly.
Internal is the thing in between the thighs and the ankles going out. Yeah. Can I have everyone's attention really quick? Did anyone notice, well, feel free to do your thing. Did anyone notice a change? An improvement? Tremendously, for some of us. If you didn't, please listen. If you did not notice a tremendous change, what you would do in theory would test the other side. Then you lay on the other side, breathe about 10 breaths, then retest. Because, right, archetypes theory, it's not exactly how it is, but we have visible things to take before and after pictures, and all you do is lay on one side. Right? Going back to at the end of the sheet, as you saw the sequencing, right? Now you have a way to practice that. I just want to show you one last thing, which is a grounding exercise. And in fact, let's all do this. Everybody, feet on the wall, lay on your back. We'll do 10 breaths and then we're done.
Some good.
Everybody, lay on your back, feet on the wall. No, knees bent 90 degrees. Yeah, you need to be scooched up to the wall. Knees bent 90 degrees. Feet on the wall. Yeah. Yep, we all have that. Once you have that, you may want your ankles a little higher. Just a little higher. And from here, you're not going to do anything except the following. Just drag, without moving your feet, drag your heels down such as to lift your hips 1 or 2 inches off the floor. It's like you're coming into a supported bridge pose. So you're just lifting your hips 1 or 2 inches by pulling heels down. You can place your hands on the back of your hamstrings and feel those turn on, the back of your thighs. You should feel that turning on as you pull heels down. Is anyone confused about what I'm saying? Okay, 10 breaths like that. Reach your arms straight forwards. Have your palms facing one another and palms move slightly towards the knees.
Towards center.
Towards the knees slightly.
Towards center.
Uh-huh. And then take about 5 to 10 deep breaths. In through nose, exhale through mouth. Your hips should be floating off the floor 1 or 2 inches. Sorry? They took it. Yeah. Practice feeling as you exhale your body and your awareness dissolving into the sense of the ground beneath you. Sorry? What was the question? Here, like wherever you feel contact with the floor, just feel that way. Yes, inhale through nose, exhale through mouth. One other tidbit of information, when you exhale through the mouth, you actually help activate the pelvic floor, which is interesting because when we're taught in yoga, we're often taught just to inhale through nose and exhale through nose. But the pelvic floor doesn't actually get as much activity. The more you train this, the better. Go ahead and lower down, having done that. And if you want curiosity, whoever did all the tests, just retest those 2 things really quick. And with this, we'll do one last mantra and we'll close. Yeah, just go ahead and retest those 2 things. And you may be like, oh my gosh, what? Shoulder internal and the hip internal. Test those 2 things again. Yeah, with the pillow or thing between thighs. Uh-huh. Yeah. Okay, and just notice if things got better. Yes, interesting. Anything different? Good. Wow. Okay. Yes. Everybody go ahead and sit up. That's what happens when you ground and lateralize through the correct side, everybody. And with that, I hope you stop doing Anjaneyasana in a way that is terrible for your back and you try this with your yoga practice. Bring your hands together. Om Devi Sureshwari Bhagavati Gange Tribhuvana Tarini Tarala Tarange Shankara Mauli Viharini Vimale Mama Matirastam Tava Pada Kamale Bhagirati Sukhadayini Mata Tava Jala Mahima Nigame Kyata Naham Jane Tava Mahimanam Trahi Kripa Mahima Nagyam. Take a deep breath in. Exhale everything out. Breath in, we'll chant Om together. Om. Feel how much your nabhi has entered into your center. Soften that area and inhale. Thank you so much for exploring some of the waters of Marma as a map, not as individual points, and what helping your brain remap these spots allows to open in your body. And hopefully you can move forward with the question that what becomes more possible for you when you get more of the support that you need. Thank you all.